Okay, we're going to go ahead and get started. Thank you all for being here. It's really exciting to see so many folks on a call about such an important topic. We know that you all, as providers and service people in the communities, have a lot of demands on your time, and for you to take the time to be here today and to be learning, we know that that is an honor for us to be able to provide that. So we'll go ahead and get started. So my name is Kate Faulkner. I'm a program manager with the Office of Prevention in the Department of Mental Health and Substance Abuse Services. We put this presentation together because we were hearing so much from you all in the community that there were questions, there were rumors, there were stories out there, and we want to make sure that you all are well equipped to be a part of changing the trajectory of the overdose epidemic here in Tennessee. So a little bit about why are we doing this presentation. So we know that the illicitly manufactured fentanyl is really driving the increase in fatal overdoses in Tennessee. So in 2020, that's the data that's most recently available, 2 out of 3 overdoses involved fentanyl. And that these fatal overdoses are increasingly likely to have multiple substances, whether a person knows that they're using multiple substances or not. So about 1/3 of those fatal overdoses in 2020 involved both an opioid and a stimulant. So it's not just a kind of one or the other, but that we're increasingly seeing more and more of those polydrug overdoses. But we also want you to realize that fentanyl-involved overdoses are preventable, and that's why you all are here, to learn, to keep working on figuring out how you can apply this knowledge in your workplace. Next slide, please. So I think the other thing that's really important for framing up today is there's a lot of talk in the media about this. I'm sure you all have seen many news stories. Maybe you've seen stuff on TV or on social media. And we want to make sure that we're thinking about, what are we consuming as far as that? And so I want to start us off today with a new research study that looked at fentanyl information in the public. And so they looked at a variety of news sources that were published on state, national, and local levels, and then shared through social media. And what they found is that misinformation about fentanyl was shared more widely than correct or partially correct information. And that 92% of those articles included misinformation, including those published by those national news agencies. Next slide. So I found this quote to be very impactful for the work that we're doing. So I want to share it with you today. Most mainstream media content on casual exposure-linked overdose fails to include the voices of scientific experts, public health officials, and people with lived experience. The DEA and other government agencies have been slow to counter and remedy these misleading statements. That is why we are all here today, to figure out what that science-based information is and figure out how to move forward from here. And this information that's out there, this misinformation, definitely has some major implications. It has consequences. So for individuals that are overdosing, people may be more reluctant to respond, or they may not provide the best interventions because they're scared. It also raises the level of stress and other mental health struggles in workplaces, and it furthers counterproductive policies that focus on punitive responses and consequences, and also can foster unnecessary resource expenditures as a result of that fentanyl panic. So let me give you a little bit of context. This is all data that's available through the Tennessee Department of Health. So the number of overdose deaths involving fentanyl has grown significantly over the last 6 years. So you can see on that graph, the red is all drug overdoses, and the blue is the fentanyl-involved overdoses. So in 2015, about 12% of overdose deaths involved fentanyl. And then you see that line going up. In 2020, that was 2,014 overdoses involved fentanyl, or about 66%. And you see that significant increase from 2019 to 2020 when those fentanyl-involved overdoses nearly doubled in that time frame. Next slide. So if you are more a numbers person and less a graph, this is another way to look at this. So in 2020, those fatal drug overdoses in Tennessee were numbered at 3,032 total. And that included all of those substances. And 2,014 of those involved fentanyl. So 66% of those overdose deaths in Tennessee involved fentanyl. And you can see there are other substances involved, and there may very well have been other substances involved there. All of that information is available in the Tennessee Department of Health data dashboard, which we can drop in the chat as well. Next slide. If you're interested in seeing like where those overdose deaths are happening, you can see this here. Of course, there are lots more in our major metro areas, but this is certainly not an issue that's only in our major metropolitan areas in Tennessee. Okay, so a couple key points as we wrap up the data and then turn it over to Brian. So in 2020, 2 out of 3 overdose deaths involved fentanyl. For those folks who were also using stimulants, 3 out of 4 of those fatal stimulant overdoses also had an opioid, such as heroin, pain relievers, and/or fentanyl. And then, if you're wondering who was overdosing fatally on fentanyl, males die twice as often as females from a fentanyl overdose. In Tennessee, about half of the people dying of fentanyl-involved overdoses are between the ages of 25 and 44. And 2 out of 3 of those dying of fentanyl overdoses are white Tennesseans. So at this point, I'm going to turn it over to Dr. Brian Winbickler, who has graciously volunteered to do this training for you all. He is very knowledgeable and is has a wealth of information to present to you all. So feel free to pay attention as he presents, but also drop those questions in the chat so he can answer those after the first part of the presentation. So I'll turn it over to you, Brian. Thanks for being here.
Well, thank you, Kate, and thank you everyone for joining the call today. This is really important, and Kate really laid out the foundation and groundwork for how this is affecting specifically our state and kind of helps explain why we're here today. And really, you guys are the boots on the ground, and you can really change the narrative and really make a big impact in your own respective communities. So I'm here today just to provide some non-biased factual information about fentanyl. And like Kate said, if you have questions, please put those in the chat. I'll answer them to the best of my ability. And with that, we'll go ahead and get started. This is what we're going to talk about today. Kate laid the groundwork with some statistics that affect Tennessee. We're going to expand on that and just talk about some fentanyl basics, what it is, how it's made, those type things. We're going to really talk about its use as an illicit substance, and that's where a lot of the questions come from, and that's where a lot of these overdoses are happening with the illicitly manufactured fentanyl, not necessarily the prescription fentanyl. We're going to talk about exposure risks and what it means to come in casual or accidental contact with fentanyl and what you should do, how you should respond, and what your overall risk of experiencing an opioid induced respiratory depression is by coming in casual contact with fentanyl. And then we'll talk a little bit about what's next, some resources available, what treatment and recovery looks like, and how it's maybe a little bit different for people that are using a fentanyl product versus maybe just a pill form or heroin. And really, education is a means for harm reduction. And that's why you guys are all here. So looking at fentanyl, it's been around for a while, and it's a very powerful pain medication. It was originally developed to help control chronic cancer type pain, that pain that's going to be long lasting and persistent, and for which there's not really another substance that can really relieve that pain. And the reason for fentanyl is unlike a lot of other drugs, maybe a blood pressure medication or a heart medication, opioids don't have a ceiling effect, and what that means is you need escalating doses indefinitely to maintain that same pain control. So if you think about someone who has a chronic pain condition, chronic low back pain, incurable cancer pain, they need opioids to control that, and they need infinitely increasing doses. So we need potent products that can continue to provide that pain relief and control. So I've mentioned fentanyl is an opioid. So just like morphine, codeine, hydrocodone, and oxycodone, but unlike those other ones, fentanyl is a completely synthetic or man-made opioid. So it doesn't have a natural derivative. It's made chemically in labs and at pharmaceutical companies. And mostly what we're going to talk about is in those clandestine or illegal type labs. The prescription type that I've been mentioning for pain control is most often prescribed by a doctor as a slow release patch to people with cancer pain, chronic other issues. And when it's used in this way, it can be very effective to control that pain and it's very safe. The first transdermal or uh, skin patch or delivery mechanism that can go through your skin was developed in the early 1990s. So starting with that most commonly prescribed prescription product, the transdermal patches are brand name Duragesic. This is a patch that goes directly on the skin and it includes fentanyl in a gel form. And that's really important because fentanyl itself is a powder and all powders are a crystalline form and those products in that form can't readily pass through skin. So this is manufactured specifically in a gel form that can penetrate that top skin layer and get to your blood vessels and go to your brain to provide that pain control. The patches slowly release that fentanyl into the skin and then the bloodstream over a period of 48 to 72 hours. So it still takes a while for these to start working. We also have some other forms that are all rapidly absorbed. These are not as common, but they provide rapid pain relief when needed. We have dissolving tabs and films. So buccal tablets, those are anything that are placed in the mouth and dissolved in the mouth. The reason for that is it bypasses what we call first pass metabolism. So anything that you swallow is typically metabolized by your body before it actually has any active effect. When you bypass that by going with the nasal route, with the nasal spray, or dissolving things in your mouth, it enters the bloodstream more quickly and exerts its action more quickly and more powerfully. So what we're going to focus on and talk the most about today is illicit or illegal fentanyl, and this primarily comes from clandestine labs or those illegal labs manufactured across our borders and then smuggled in primarily through the southern border in Mexico. It comes in various forms. So a powder form, just a general white powder or off-colored powder, and on a subsequent slide, I'll show you some different variations of what the color might look like. It can be dissolved in water or another substance and then dropped on blotter paper in small candies and taken that way. In the liquid form, it can be in eyedroppers or nasal sprays. And another really concerning form is pills that look like real prescription opioids, but are actually fentanyl pressed to look like a normal tablet. So you might be familiar with how an oxycodone looks or a Percocet that's prescribed by your doctor if you've had a wisdom teeth surgery or any other kind of acute pain that you needed controlled. So we're familiar with what those look like, and they're perceived to be safe because they're prescribed by a doctor and they're dispensed by a pharmacist. But these pills are actually fentanyl or other products pressed to look like those products, so they're very dangerous. We also talk a lot about fentanyl and its analogs. So when fentanyl is being manufactured, just keep in mind that a lot of the manufacturing is by people that aren't trained chemists. They're not physicians, they're not pharmacists, they're not medical professionals. So it's a lot of trial and error, and a lot of times they create things that are more potent than fentanyl. And three of the most commonly seen analogs are acetylfentanyl, furanylfentanyl, and carfentanyl. Those are some examples. Now, when you look at these are all a little bit more potent than fentanyl, and carfentanyl is the most potent fentanyl analog that we've seen in the US, and it's estimated to be about 10,000 times more potent than morphine. So, if you think about relative potencies, carfentanyl is what the Knoxville Zoo or Memphis Zoo or any kind of large animal facility would use to put elephants to sleep for veterinary procedures. So when you think about the size of an elephant versus the size of you or me, that kind of shows you the relative potency of carfentanyl versus something like heroin or just fentanyl alone. We have databases of these analogs, and they're identified and labeled through lab testing. So you can't really tell by looking at a product exactly what it is and what's in there. So that takes advanced laboratory procedures, and the DEA maintains a database that we can compare the samples that we get in our communities to determine exactly what the product is. The TBI has reported a significant increase in lab samples containing fentanyl and its analogs. And remember, on Kate's slides, we saw that steep increase in overdose deaths and the use of fentanyl products. And from 488 samples that contain carfentanil in 2017, we have a lot more of those samples that contain that in 2020, and that's really driving a lot of these overdose deaths is the inclusion of fentanyl and its analogs in heroin, in other pills, mixed in with other stimulants. So it can be found in a lot of products and it's really potent. So that's really what's driving a lot of our overdose deaths. What makes fentanyl different, and I've been talking about this a lot, is its relative strength and potency versus other opioids. So you can see there's to the right of that penny, there's a few grains of fentanyl. Now, to you or me or someone who's opioid naive, that could be a lethal dose of fentanyl if we were to inject that or take that orally, or it gets in our nose or our mouth, or we touch it and we get it in our eyes or another mucous membrane. That could potentially cause an overdose for you or me. With For people that are frequent opioid users, they have a tolerance, so that may not be a fatal overdose for them, but it would be for the opioid naive patient. Over there on the other side, that just pictures the relative strength when compared to 10 milligrams of morphine of a variety of products. And you can see there that fentanyl is about 100 times more potent or stronger than 10 milligrams of morphine. And then there's some other common products listed there as well for your reference. So we know that fentanyl's dangerous. We know that it's really potent. We know that it's driving a lot of our overdose death rates. So what are some other properties? And it would be great if there was a specific taste and we could tell that something was fentanyl, but it doesn't have a taste, and there's no guaranteed way to identify it by taste. There have been some studies with people that do use fentanyl regularly and other opioids, and they have anecdotally said that fentanyl tastes sweet, whereas heroin would be more bitter. But I put this in bold because this is really important for you guys to know that this is just anecdotal and it's not a reliable way to identify the drug. It would also be great if we could just smell fentanyl, if it smelled different than heroin, if it smelled different from other opioids. But fentanyl doesn't have a unique smell, so there's no way to identify it by smell. Color, it can be white, like heroin in pure form. It can be off-white, it can be tan, it can be brown. All of these colors, and you can see over there on the right, the variations of what we've confiscated and found and what this looks like. It really relies a lot on what it's mixed with or cut with, and we'll talk about that on some other slides. So where is all of this coming from? We know it's dangerous. We know it's being smuggled into the States, but where and how is it made? The majority of the precursor chemicals, and remember, this is all man-made, so the chemicals that we need to make fentanyl are most often made, manufactured, and then distributed out of China. So you can see here the majority of those come from China and then they come into the United States. Most often, these are shipped to the southern border and then manufactured, manipulated, and then smuggled across the border. This also happens through our northern border with Canada. And in some rarer instances, it's shipped directly to the United States. And that's because we have such a great postal service and things are delivered reliably and on time. So looking more specifically at some of the chemical chemistry and how this is made, and over there on the left side, the key ingredient is phenethyl 4-piperidine, so NPP for short. You can get 25 grams of this bought from China for about $87. So that $87 investment can then be mixed with about $720 of chemicals that can be purchased legally in Mexico or the United States or other places. Those are then combined, so your total cost is about $810 to produce some fentanyl. You can then take that initial investment, divide that up into tablets that equal about $800,000 worth of pills on the black market. So that's why this is so lucrative. And when you think about, well, why fentanyl versus heroin and other things, it's because such a small amount can be smuggled in and then it can be divided up and mixed. And we'll talk about cutting and mixing next to make large quantities for sale. So if you look on the right side, remember, these aren't chemists, these aren't professionals. So they've got a filler substance that they're cutting into that. You've got the fentanyl, that's the bottom, the black dots. And then when you mix all that together, you press it into tabs. And on the far right side, you can see you might get a pill that has no fentanyl in it. You might get one that has a little bit. Or you might get the pill that ended up with a lot of fentanyl, which is a lethal dose. So when it comes to tableting and making these and distributing these products, there is no reliable way to distribute the fentanyl evenly. So one time might not be a lethal dose, the next time could be a lethal dose. So cutting, mixing, and lacing, what does all this mean? So basically cutting, mixing, or lacing agents fall into two categories, diluents and adulterants. So diluents are anything that you use to make more of a product. So you're just bulking it up. That can be a white powder, sugar, cornstarch, baby powder, you name it, anything. More product equals more profit. So they take a very small amount of fentanyl, they cut it or mix it with a bulk product, flour, you name it, anything, and that creates more product that they can sell, which equals more profit. There's also adulterants, and those are used to mimic or enhance a drug's physiological effects. And fentanyl itself is a known adulterant. So fentanyl is oftentimes used combined with heroin and marketed as better heroin. It can be combined with stimulants like cocaine and methamphetamine to be marketed as a high quality cocaine. It can be combined with just about anything. And one thing that we're seeing a lot of is it's mimicking more expensive or more difficult to obtain drugs like pills and tablets. So an oxycodone or a Percocet. So we've legislated and controlled the distribution of those products from the both the physician side and pharmacy side. So those aren't as readily available. So the ones that are come with a pretty hefty price tag. So you can use fentanyl, dilute it, press it into tabs, and then you've got a product that's potentially lethal, but it's much cheaper on the street in terms of market price. So again, a lethal dose of fentanyl, and I mentioned this for the opioid naive person or someone who doesn't take opioids regularly, it could be about on average 2 milligrams, but that varies on several factors. So body size, tolerance from previous use, your general metabolism, liver function, a lot of other things. So 2 milligrams is just a ballpark figure, but a lethal dose varies from person to person. Again, measuring such small amounts requires laboratory conditions, which these clandestine or illegal labs typically don't have. So it's very difficult to distribute that fentanyl evenly. So you can get a tablet that has a lot, or you can get a tablet that doesn't have a lot. And from DEA data, 1 out of every 4 counterfeit tablets contained a potentially lethal dose of fentanyl. So a 25% chance that out of every 4, one is going to have a lethal dose. Additionally, other drugs, and I've mentioned this like cocaine, methamphetamine, benzodiazepines like Xanax, are also being mixed or laced with fentanyl. So people out in your communities or regular consumers of these laced substances may be completely unaware that they're ingesting fentanyl. So they might be borrowing a tablet or buying something off the street they think is a Xanax, but it's actually fentanyl. They might be buying something they think is a hydrocodone, but it's actually fentanyl. It's extremely dangerous because people are unaware and they're at a really high risk for an accidental overdose when fentanyl is mixed or included in any other product. So the DEA analysis found counterfeit pills ranging from 0.02 to 5.1 milligrams. And remember, for the average person, about 2 milligrams is lethal. And 42% of those pills tested for fentanyl contained that lethal dose. So almost half. And when you look at this, drug trafficking organizations, they typically distribute fentanyl by the kilogram. That's just how they package it. And 1 kilogram of fentanyl has the potential to kill almost 500,000 people. So when you look at the fentanyl that might be coming into your communities, it's not a benign product. It's extremely lethal, and it's really being mixed into a lot of things that you might not be aware of. It's possible for someone to take a pill without knowing it contains fentanyl. And also, people might be seeking out fentanyl, but be unaware of how much fentanyl is in that product. So, ways to reduce harm and identify fentanyl. And as I've talked about before, this is really challenging because it doesn't really have any unique product properties. It doesn't have a specific taste. It doesn't smell different. Um, the powder looks just like heroin or other powders, so it's really hard to distinguish fentanyl from heroin or other products. But we do have fentanyl test strips, and these are small strips of paper that can help detect the presence of fentanyl in any drug batch, and this can be life-saving for people when they may be thinking that they're using heroin, but it's actually laced with fentanyl. So these strips are relatively easy to use. You basically take any amount of the powder substance or whatever you're wanting to test, you dilute it in water, you put the test strip in there, it runs up the test strip, and if there's two red lines on that test strip, it's negative for fentanyl. If there's just one line, then it contains fentanyl or one of its analogs. So the majority of fentanyl test strips on the market cost $1 or less, and they're 96 to 100% accurate in detecting the presence of fentanyl. And the current strips that are out there on the market can detect at least 10 fentanyl analogs. So it can detect the carfentanil, the acetyl fentanyl, and those variations of the fentanyl product. So they're a very helpful tool in the fight against overdoses. And there's a bill in the legislature now to make these legal because currently in our state law, they're viewed as drug paraphernalia. So while we're seeing these and we're using these in a lot of our syringe services programs, this will help if we get this bill passed to look at this as a harm reduction tool rather than an illicit product. So a lot of questions come based on, am I at risk if I'm exposed to fentanyl? So this would be someone who's not a fentanyl user or an opioid user, and they come in contact with fentanyl. So the most important thing to remember here is to overdose on an opioid, any opioid, including fentanyl, that product has to get to those special receptors in your brain that control your breathing rate. So ways that that can happen include ingestion, so swallowing, chewing, or eating, direct mucous membrane contact with the eyes, nose, or mouth. So those entryways that bypass our skin. Our skin is our first line of defense and is great at protecting us. And then inhalation or breathing. So we'll talk about each one of these individually. So when it comes to contact with the skin, the only form of fentanyl that can easily and readily go through your skin is the pharmaceutically prepared fentanyl patches. So when it comes to those patches, if you come in contact or direct contact with a fentanyl patch, you don't have to worry a lot. And the risk is really with children and pets that might come across one of these in the trash and chew on it or get it in their mouth orally. It takes 3 to 13 hours for fentanyl patches to deliver enough drug to produce any kind of noticeable pharmacologic effect, and then 35 hours for the full effect. So if you just briefly touch one, if you wash it off, you'll be just fine. So it takes a long time for that gel to pass through the skin and get to those capillaries and blood vessels to be carried to your brain. The crystalline powder, and that's the majority of the product that's in our communities, is a powder. It's if you look at it under the microscope, it looks like salt crystals or something like that. And those forms can't readily pass through our skin. So if you touch or come in direct contact with fentanyl, it's virtually impossible to overdose from that. Now, if you have cuts or open sores on your hands and they're actively bleeding or you can see blood, it's that blood that you're going to need to see that's that pathway to your brain. So if you have small cuts that are healing, but they're not bleeding, you're still okay. So your intact skin will protect you. Broken skin, bleeding skin, open sores, that is also a way to get it into your bloodstream where you might experience an accidental overdose. If you do get it on you, on your hands or any other part of your body, wash your hands with soap and water to remove the fentanyl. Ideally, hot water is best, but any water and soap will do. Don't use alcohol based hand cleaners and sanitizers. The reason is with alcohol based hand sanitizers, they work great for viruses and bacteria because the alcohol actually kills the bacteria and kills those viruses that might be on your hands. It does not remove them. So, alcohol, there's nothing to kill with fentanyl. So, there's nothing to deactivate. So, if you use those alcohol based hand sanitizers, the fentanyl is still on your hands. So that's why you need to use soap and water because the soap will physically remove the fentanyl and the contamination from your hands. And removing it from your hands is important because that's how it's going to get into your system via your mouth, your nose, your eyes. That will be how it gets in. Also, alcohol-based hand sanitizers for people that work in the hospital or use them frequently, you'll notice they really dry out your skin and they thin it out and it starts cracking. So that's also a way it kind of breaks down that integrity of your skin. And the oils, the natural oils on your skin, are part of that resistant barrier that helps keep things out. So, in terms of the relative size of particles, when we look at what our skin can protect us from, fentanyl is up there with the dust particle at about 10, 10 micrometers there, nanometers. So look at all of the things below fentanyl. You have the Zika virus, you have the coronavirus, you have bacteria, you have the flu. So if fentanyl were allowed to pass through our skin, then all of those other things would easily pass through our skin and we would be sick all of the time. But we know that hand washing is a great way to avoid getting coronavirus and the flu because it has to be carried into our system some way. So our skin is a great line of defense, and just touching fentanyl isn't going to cause an overdose. So if you look there, there's a whole lot of things that are much smaller than any of the fentanyl particles that you'll come in contact with. So this is the same for all opioids. So whether it's fentanyl or carfentanil, they're all crystalline in nature. Their potencies and strengths might differ, but the molecule size is the same. So it doesn't matter if it's fentanyl versus carfentanil being 10,000 times stronger than morphine or heroin doesn't mean that it passes through your skin easier. It just means that it's more potent, and if it gets into your system, it would cause an overdose faster or more quickly than a less potent opioid product. Inhalation or breathing fentanyl is not aerosolized very well. It doesn't evaporate into the air. So basically, it stays where it is. So it's fentanyl's the same as all of the analogs. None of these really get into the air. So fentanyl powder on carpets or hard surfaces will stay where it is. Now, that being said, if you turn on a fan or there's a pile of fentanyl right in front of an air return vent or something like that, and it's really powerful and it sucks it in there, then it could spit it out into the air. But if you're just coming into a scene or into a place where there's fentanyl present, it doesn't get into the air. So breathing that in is a relatively small risk. You wouldn't want to use a vacuum cleaner or anything that would push that into the air. But in general, fentanyl will stay where it is. Now, if you're law enforcement and you're bagging it up and then you push air out of the bag, that can aerosolize the fentanyl, and breathing it in is absolutely a way that that can get into your bloodstream and go to your brain. So as long as it's not disturbed, it doesn't readily get into the air. Now, speaking of lung exposure and breathing it in, vaping is a concern, and the FDA regulates very few nicotine vaping products and no marijuana products. So, that being said, can fentanyl be in vape and can it be in marijuana products? Absolutely. Fentanyl is being introduced to a whole host of products. And remember, it's being used as an adulterant to potentiate effects and be marketed as a better product. So outside of FDA regulated products, knowing exactly what is in a vape product is extremely difficult. And the only way you can do that is with advanced laboratory testing. So those uncontrolled vaping products that you can buy at vape shops, vape juices, all of those things, it's very difficult to tell what's in there. It's possible to add anything into a vape product. It's possible to add anything to marijuana, including fentanyl. So while the inclusion of fentanyl as a really highly potent substance in vape products is alarming and really scary, there have been very, very few case reports of this actually occurring, and even fewer laboratory confirmed cases. So when you see things on the news about vaping and being exposed, those are very concerning, but luckily in Tennessee, we haven't seen any overdose directly related to laboratory confirmed cases. Doesn't mean that it couldn't happen, but we're not seeing that. So, signs and symptoms of an overdose, this can be from any opioid, including fentanyl. If you look over there on the right side, the blue portions on the bottom, those are our mu receptors and those receptors in our brain that help control our breath, our breathing rate. So if you have two of those receptors in your brain and an opioid sits down on one of those, your respiratory rate will drop in half, or roughly 50%. If another opioid sits down on there and your two receptors are completely occupied, that's when you would stop breathing. So that's kind of how this works. Opioids are depressants, so they slow down your body function. So everything slows down. With stimulants, it's the opposite. Everything tends to speed up. So signs of an opioid overdose include being unresponsive, breathing that's labored or very slow, choking sounds. The body might be limp. Their face and lips might be turning blue. They might be pale or clammy. So those are the telltale signs that it's opioid related. Now, if it's stimulant related, you would see kind of the opposite of these effects. So a lot of times what might happen is, let's say someone does come in contact with fentanyl or another opioid. Just be aware that an opioid overdose, everything would start slowing down. Their heart rate wouldn't increase. Their breathing rate wouldn't increase. It would slow down. So a lot of times what we see is based a lot on what Kate mentioned early on, is that fentanyl panic. So people might be experiencing a panic attack because they're not aware that their risk is relatively low of experiencing an opioid overdose just from incidental or accidental contact with fentanyl or another opioid substance. So, what should you do if you are exposed? Remember, it has to get into the air for you to breathe it. So, avoid performing any tasks or operations that cause it to become airborne. Don't touch your eyes, nose, or mouth, even if you're wearing gloves. So, if you're wearing gloves, a lot of times we think, oh, those gloves are to protect that substance from getting on my hands and getting into my system. Well, your skin will stop that. So it's the actual product being on your hands or on your gloves, and then that being carried to one of your mucous membranes. That's where the risk is. So remember, wash your hands with soap and water. Try to avoid those alcohol hand sanitizers because they're not going to remove the fentanyl. Only soap and water can do that. Going to the hospital following a known exposure is just a great or good idea. You don't necessarily know if maybe you touched something that had fentanyl on it and then touched your nose, mouth, or eyes, and you could eventually experience an opioid induced respiratory depression or overdose. And going to the hospital where they can treat that readily is just a good idea. Just because someone goes to the hospital after coming in contact with an opioid or fentanyl doesn't mean that they're overdosing. It's just good general practice should some of that fentanyl have gotten into their bloodstream somehow, some way, and they didn't know about it. When it comes to treatment and recovery, remember fentanyl is a lot more potent than prescription opioids and heroin itself. So the length of time an opioid has been used and the frequency and specifically potency, and this is where fentanyl has its main issue, is with that potency and strength. So time, frequency, and potency, those three really play a large role into how someone is going to need to be treated to start their recovery. So fentanyl is very potent, and many people who use heroin or heroin laced with fentanyl are going to need some kind of medication for opioid use disorder to help control those cravings and help give their brain time to heal. So methadone, it's a very potent MOUD product that's commonly used. And the reason methadone might be preferred for people that are using heroin and heroin laced with fentanyl is it can be titrated to an appropriate dose. And we know fentanyl is ultra potent. So other products that are available, like buprenorphine or Suboxone, they have a ceiling effect. So at the maximum dose, they don't do any more to help control those cravings. And if you're on an ultra potent product like fentanyl, you might need methadone because it's a direct agonist and it's just like an opioid and it doesn't have a ceiling effect. So it can be titrated to a dose that's relatively equal to what they were using with fentanyl to help them access that recovery. Pregnancy is also a huge issue. So, opioid exposure during pregnancy has been linked to a whole host of poor health outcomes, maternal death, and then for the babies, poor fetal growth. It can cause preterm labor, it can cause stillbirths, a whole host of different birth defects depending on how long the opioids are used in what trimester of the pregnancy. And then I think most people are kind of familiar with neonatal abstinence syndrome. And with this, I want to make it very clear to you guys so you can educate your communities that when a baby or infant is born, they to a mother that might be using a substance, they are born dependent on that substance. They're not born addicted. So, addiction is a psychological and physiological manifestation of any kind of drug use. Babies, they didn't have a choice in that, right? And they're just born dependent. So, neonatal abstinence syndrome, they might be given a replacement product and weaned off of that substance. So, infants and babies are born dependent, they're not born addicted.